So, you guys all, thank you very much for coming. This is the ABCs to avoid breast cancer talk. I'm your woman of wellness. My name is Dr. Claire O'Neill, and I'm here to help you understand all the importance of breast health. Right now it's October, and they consider that Breast Cancer Awareness Month. I think that is an incorrect way of approaching it. It's actually Breast Health Awareness Month, and that's my job today, is to help you understand all the aspects and importance of breast health. So there's a lot of aspects when it comes to breast health that people don't understand. So I'm going to be giving you stats that are going to be kind of eye-opening. And the reason why I know a lot of these stats is because Yvette, who's in the blue and the white, was a very close friend of mine. She was diagnosed with breast cancer, and she went the medical approach, and which is mastectomy, right? They do radiation, they do chemotherapy. We were then told she was cancer-free. 3 years later, she found breast cancer on her other breast. Again, did the medical approach. Mastectomy, radiation, chemotherapy. And then, after going through those procedures, we were told in September she was 100% cancer-free. So we thought we had made it through those, basically 6 years of hell. What ends up happening is in January, the following January, they found the cancer in her brain, liver, and lung. She died 9 months after us being told she was 100% cancer-free. Here's the crazy thing. Breast cancer is the #1 killer of women. I'm going to backtrack. Sorry. First of all, it's a #2 killer of women total. #1 killer of women happens to be heart disease. Okay? But it's the #1 killer of women from the age of 35 to 45. Yvette died before she hit 45. So that's an epidemic. That's what I don't think people are actually hearing about. And when it comes to how this education is being brought out, there's a lot of things that happen through what I call the medical money machine. I kind of backtrack on that because people don't understand, even though I'm a chiropractor and all those other aspects, I actually have a background in medicine. My dad was an MD, and I was in pharmacy, inpatient and outpatient, for over a decade. So I always joke around and call myself a legal drug dealer. So, but that has caused a lot of problems. That's what I call the insanity of the medical money machine. There's a lot of things in medicine that has been created to protect us, but actually causes the problem that they're trying to protect us from. And one of the biggest is the mammogram machine. Okay? 1982, the mammogram machine was approved by the FDA, right, to diagnose breast cancer. The mammogram machine actually compresses your breast tissue with 67 pounds of pressure. If you actually have a cancer tumor in that breast, it can easily burst that tumor. Research shows only 22 pounds of pressure is needed to burst that tumor. And if it bursts that tumor, it's now spread your cancer. That's when we use big words like metastatic, means it's moved all throughout, which is what happened with Yvette. It had already gone into the lungs, the liver, the brain, and actually into the other breast. So breast tissue is also very hormonal, so it's very sensitive. Having direct contact radiation, because that is what a mammogram is, direct contact radiation. That radiation can be very destructive to that hormonal tissue. And that is also associated with the pressure on that breast. And in today's society, mostly with all the mastectomies, we have a lot of augmentation. We have a lot of, with the augmentation, either saline or, I can see it right now, saline, silicone, thank you very much. With those breasts, what actually happens is the pressure of the mammogram actually will burst the augmentation too, and then all of those fluids start spreading into the breast tissue, which of course causes a lot of problems. So very hazardous to breast implants, direct contact radiation. So what's the side effect of radiation? It's breast cancer. So we have created a machine that's supposed to protect us from cancer that causes cancer. Is that logical? So what happens is research shows that one mammogram series is equivalent to over 500 chest x-rays. And then we do it annually. And right now, what they have done is we have found, we'll have women with quote-unquote dense breast tissue. And with that dense breast tissue, it's very hard for mammograms to be able to read it. So guess what they have done? They have said you need another diagnostic procedure because you have quote-unquote dense breast tissue. So guess what medicine has done? They created the 3D mammogram. How much radiation do you think is in a 3D mammogram? So I'm here to show you that that's not the answer. The medical money machine is not the answer when it comes to breast health. It's actually infrared thermography. And infrared thermography is what's going to help you see so much more on your breast health. I can see so much more on your breast health. So first of all, it is FDA approved, right? And it was approved by the FDA back in 1982, the exact same year as the mammogram machine. 2, no radiation. There is no breast smashing, no contact, right? No pain. It's 100% non-invasive. And what happens is my cameras that we use for infrared thermography, I mean, most people are starting to understand the concept of infrared thermography now, mostly because of, like COVID. Everybody understands those heat signatures because everybody's doing those temperature readings. Well, what happens is the cameras that we have are even more in depth. They're even more diagnostic than what those cameras that you'll see on your own phone or on the temperature scans. They're pretty amazing. And they're 100% non-invasive. So all of your cell phones that you have on your body or near you are a way more, health issue to yourself than my cameras. 100% non-invasive. Now, going back to kind of the hypocrisy of the medical money machine, the other thing is infrared thermography, I'm actually seeing 100% of the breast and chest area. With a mammogram, I can only get what we call the fleshy part of the breast. How much breast cancer do you think is found in the fleshy part of the breast?
30%.
You're right, only 30%. Brilliant. 70% is found in what we call the upper outer quadrants, right here. So, medicine's gold standard, which is that's what they put all of their focus on and trust, their gold standard is only getting 30% of that breast cancer. Does that make sense? That makes no sense at all. So, infrared thermography, as I said, is what is really going to help us determine how your breast health is and help us follow your breast health. There's a few things that are very important about this people do not know. Out of Cornell University Research 2008, it's 97% accurate. Did you know that over half of mammograms that are negative are actually incorrect and there actually are positives? And I have a lot of mammograms I'm going to show you soon that show up negative when it should have been a positive. You get a lot of false positives and false negatives. Now, breast cancer is a 15-year disease. So it's been growing inside us, right, for 15 years. Usually that tumor has to be 1 to 2 centimeters in size before a mammogram, self-breast exam, ultrasound, sonogram, MRI, etc. can find it. Those diagnostic devices are what we call anatomical or structural. You have to have that tumor in there for them to find it. Now, when it comes to infrared thermography, I'm not looking for the tumor per se. I'm looking to catch it before that tumor is big enough to be seen. So I'm looking for physiology, and I'm looking for changes in physiology. So my job is to catch it 100% year one before it even becomes a cancer in the first place. And by the way, did you know your body's been fighting cancer since you were born? Your body's fighting cancer right now, right? So our job is to make sure we help your body fight that cancer so it does not become a concern. The other thing is a lot of times, because this device, diagnostic device, has no side effect, anybody can buy it. It's expensive, but anybody can buy it. The problem is are they using the protocols correctly? 1 for the camera, 2 for the room, 3 for the patient. Most often the answer is no. The other thing is when it's being done right and it's being done correctly, you want to make sure the doctor that is reading those reports, their malpractice covers. Often people will be called thermographers when they're actually not doctors. And they'll do the therms following whoever sold them the camera, whatever they told them to do. And then they try to go look at the colors and go, oh, this is this, this is this. Or they'll send them out. Often they're being sent out to doctors on the East Coast. And these doctors are PhDs, right? Well, a PhD isn't a non-diagnosing doctor. Their malpractice is not going to cover it. And in the state of California, only 3 doctors that can be covered in the state of California, except it might be 4. They might have added naturopaths. But it's an MD, it's a DO, and it's your DC. You might have your NDs in now. So that's one of the other things. So again, it's going to be read by me, and I guarantee you the technicians that we train are very specific about protocols, because that is the most important, is very specific protocols. And again, it's great for dense breast tissue, implants, and by the way, it's a great way to follow if somebody does have breast cancer and as they're following their treatment protocols. So that's a really important one. So the other type is when these protocols are being done, we do what's called the breast stress study system. And do you remember I was talking to you? It's about physiology. It's not about the tumor. It's about catching it before it becomes the tumor. This is how we do it, okay? So first of all, we're going to take our first set of scans, right? Then we're going to put your hands in cool water. So the first set of scans, a couple of seconds. Then you put your hands in the cool water, about 60 seconds. Then we take our second set of scans. You will notice that these scans look more red and these scans look more yellow. What I'm looking for first is the body has its own innate intelligence, and that innate intelligence knows its normal blood supply. So when you get cold, such as putting your hands in cool water, blood will leave your extremities and go to your organs to keep your organs warm. That's what we call a normal physiological response. But if you have cancer growing inside your breast, cancer actually creates its own blood supply through a process called angiogenesis. That blood supply is not part of the innate intelligence. So that blood is not going to go to the organs. It's going to stay to feed the cancer. Does that make sense? So what I'm actually looking for is I'm looking for a change. I'm looking for 1, temperatures to decrease. 2, thermal patterns, like those red ones, to go down. And I'm looking for vascular changes. And I will show you some on the next one. So in this person's case, temperatures went down. You can see those red spots all cooled. By the way, she was a patient of ours at GFCA. She was a chiropractic patient. She went to a very famous doctor in Beverly Hills, MD, who does thermography, also does bioidenticals. He said, that doesn't look very good, right? You might have a problem. We might need to do some other stuff. And I'm like, I've known you for a long time. I don't think so. Let me do the therm. And we did the therm. I'm like, no, you're 100% fine. I don't think we need to do any further testing. I think we're in good shape. Okay, so now I'm going to kind of show you some of these thermograms and show you some of the things that medicine has missed. First of all, this is inflammatory breast cancer. Now, this patient right? First, she wasn't comfortable. Someone was not comfortable with her breast. She's like, ugh. So she went to her MD. The OBGYN says, okay, we're going to do a mammogram. She did a mammogram. It was negative. And then she came back. She's like, no, it's still not right. And so he's like, okay, we're going to do ultrasound. Ultrasound was negative. Still wasn't happy. 2 weeks later, they went back and they did an MRI. All of them were negative, right? And they could have been doing that all day long. Because inflammatory breast cancer, there is no tumor, right? So when you're looking at this, and I'm going to make it really easy, right? Blue is good, right? This is how I'm going to explain it today. Pretty basic, but it's not all specific. Blue is good, red is bad. See that entire breast is red? Inflammatory breast cancer. She was smart though. Guess what she did? She followed her gut. She did not follow what the MDs were telling her. Smart. That's what we have to learn to do. We have to learn to follow our gut. So of course, she went and got a thermogram, and she was a smart lady because, by the way, inflammatory breast cancer, one of the most aggressive breast cancers around. Because she was a smart lady, she's still alive. Now another one, when I'm looking at your breast health, often we'll have lumps, right? And that'll kind of freak us out. So, do I want to go to a mammogram and get and get a mammogram done? If I do, guess what that mammogram is going to be able to say? It's going to say, one, if it spreads it, gosh forbid. Or two, it's going to say, guess what? You got a lump. See, mammogram, ultrasound, so breast exam, MRI, sonogram, whatever you're going to give, is not a non-true diagnostic. The way it is they have to do a biopsy to determine that. Now, if they do the biopsy and they say it's negative, we say hallelujah, right? If it's positive and they did the biopsy, what have they just done?
Aggravated.
They have spread the cancer, right? Because the body walls it off into what we call a DCIS, ductal carcinoma in situ. In situ means the body is walled it off so the cancer can't grow. But you pop it, you've just let it open. Now, if they do that biopsy and it's negative and we're saying hallelujah, right? Did you know they just increased your chance of breast cancer by 67%? I have multiple patients, thermograms, that they had negative biopsies, and guess what they've done? It's turned into cancer 10 years after that, in the exact spot that is. So we don't want that, right? So this lady had a lump right here. She didn't do a mammogram. She didn't get a biopsy. She came and did a thermogram. Now remember, we think blue is good, right? Is that what we've determined? Mm-hmm. Am I going to worry about that? Mm-hmm. Okay. The reason blue is good is how these cameras are working. Is, remember, I'm looking for blood flow. And do I have any blood going to that area? It's not being any cancer. It's not cancer. Cystic, fibrocystic, dense breast tissue. Could be fibroadenomas, any of those. But what's important is once we know that, we need to follow it. Because these are benign conditions, but we also call them precursors because they can morph into breast cancer down the road. So our job is to keep following it and making sure it stays there and it doesn't change or morph. Okay, next, hormone imbalance. So all of this just off of one thermogram, right? You get a mammogram, that can't tell you anything. It's like, oh, you got a lump there, right? I'm able to tell you all of this information. So too, if you have certain specific patterns, that lets me know if we have a hormone imbalance. 93% of the time, a hormone imbalance is due to too much estrogen. And everybody goes, ooh, is that my body's estrogen? No, it might be xenoestrogen from outlying factors. And I will go over that in a moment. But you want us to know if we have those patterns, because we want to be following that hormone imbalance, and we also want to fix it and change it. Does that make sense? Okay, now we're going to go into the important stuff, warning signs, right? So, say you have a new lump that comes out of nowhere and you're like, oh my God, what is that? Where'd that come from? You definitely want me to check it. But guess what? That happens all the time. Mostly if you've made it through menopause and you're kind of like on the other side down, we get lumps. Oh my God, do we get lumps? We get lumps everywhere. It's kind of scary. And the other thing is when we have these cysts as, a possibility, right? Say you did have a mammogram the year before. That mammogram could have damaged a lot of that breast tissue. Well, then you're going to get an inflammatory response. Inflammation's going to get in. You're going to get scar tissue around it. And one, it could just fill up with scar tissue or it could be a cyst. Okay? So don't worry. Just have us check it. Keep your eyes open. That's what we're doing. Next, an increased size of the breast. You can have it grow bigger or smaller. Well, did you know you can get mastitis even though you've never been pregnant? Mastitis. It'll inflame the whole. I've had mastitis. I've nursed children. You get that, the whole breast will expand. Inflammation, that can build it up. Don't worry. It could be something like that. A breast appears unusually higher or lower. Well, if we get scar tissue in that breast or those lumps, it will drop the breast or it can pull it up. Don't worry. We just need to check it. Never assume the bad, right? Because the bad is not as often, but we got to keep a close eye on it. Any puckering, coloring, or rash or texture changes. So you'll get puckering, you'll get dimpling. So the person with the inflammatory breast cancer, in her case, the thickening of the skin was kind of like a lemon or an onion peel, right? And so you can get that, and you can get dimpling. You can get dimples of it. But, right, I know people that get eczema on their breast or get little rashes on their breast. Don't assume, right? Our job is to check it. Discharge or any bleeding, anything from the nipple, okay? Did you know that you can lactate even though you've never been pregnant? So that could happen. Fungal infections can also leak out of our breast tissue, right? So don't assume it's bad, but you definitely want to make sure that we're keeping a close eye on it. Does that make sense? Okay. Now, there are a lot of causes of hormone imbalance. This is my basic encompassing, right? I say one, this is crazy. Avoid soy, avoid flaxseed. I've been saying that for 15 years. And people think I was nuts, but it's all coming out now. Soy bad, whether it's GMO or non-GMO. Flaxseed, you want to avoid a lot of these. And have you any of you guys ever heard of the Plant Paradox book and the lectins? All of these seeds and our nightshades we got to watch because that can easily morph into what we call a xenoestrogen. Also, all of the petroleum chemicals that are found in most of our hygiene products, propylene glycol, parabens, phosphates, sulfates, phthalates, they're everywhere, right? And they're not going away. And there's a couple of things that kind of freak me out. One is, right, any of our cycle pads, for our menstrual cycle pads, only do 100% cotton. Please only do organic. Same when it comes to tampons or any of those, because we've had a big rise in cervical cancers too. And I stop and think of all of those chemicals that are actually going inside. That actually goes on to the birth control pill and HRT, hormone replacement therapy. Hormone replacement therapy started back in the, 70s, 80s, blah, blah, blah. You had permanent Provera. They saw an uptake in breast cancer. So then they're like, oh, this is, and then they started tracking that this is not good. So guess what they did? They kind of stopped it. It was quiet. But how did medicine bring it back? Instead of giving it to you orally, now it's vaginal. And they think that that is going to be a better way to protect us. Don't fall for it. Yeah, I dealt drugs. I know it. Just because they give it a different way doesn't mean the true process is not occurring. Birth control. It affects our hormones horrendously. Synthetic, All these are synthetic hormones. All of these affect our body everywhere. And then we're getting it from all the stuff that we put on our bodies. So I actually use 100% organic facial lotions. I use all of this. So this is a patient of mine. She does 100% organic. There is Hippies. Shoot, it's in the back room. I was going to bring it out. What was it? Honeybee Hippie. Brilliant. Oh. This lady has a great line. They even have toothpaste and she calls it tooth powder. So all of these other things are what we need to start putting on our bodies instead of all of these chemicals, right? Because I'm a chiropractor, I really focus on subluxations because that nerve interference means that our body is not working to 100%. Our immune system can't do its job, and our immune system needs to be fighting that cancer constantly. So we want to keep a close eye on it. We need you 20 to 30 minutes of cardiovascular exercise a day. Lowers estrogen. Very important. Very important. And so keep a clean, good idea on all of that. Now, so we're talking about chiropractic adjustments. Very important. Hormones, supplements. Come on in. There. And then, so we have supplements that are hormone balancers. And so one of them is Simplex F, which is really important, mammary PMG. We have breast detox oils. Okay, they're essential oils, they're breast detox. Very good to help detox all the chemicals out of our breast. Iodine. Iodine is really important for the thyroid. And thyroid is really important for hormone balance. So we have to think of all of these other areas that comes into. Again, avoid your xenoestrogens. And guess what? This book, Dress to Kill. Do you want to know what this research is all on? Bras. So first of all, do me a favor. Any wires in your bras, don't wear wired bra. Keep your bras down to as low number of hours as possible. There are a lot of great bras out there that are very inexpensive. Dr. Cynthia, my associate, she actually found some good ones that you can even get at Target. So you don't have to spend a lot of money. And they've done a lot of great bra research. But you don't want the big one, the ones that are like sports bras that I use the term uniboob, that make uniboobs, because then things can't move and we don't want the heat. So we want to make sure we have everything moving and we've got the heat for that. So don't wear your bras too long. EMFs, cell phones. Please get your cell phones away from your body. I always joke around about, because my daughter went to a girls' school and they'd all be putting their cell phones right here, right? Don't do it. Don't put it here. Ovaries. Please don't put it back here. Keep it off your body to the best of your ability. We don't want to have any problems with that. And I have a problem with laptops. Who in the heck named it that way? And those things get freaking hot. And you're laying them right here? Oh my gosh, that's nuts. I have a problem with that. Okay, so there's a lot of things we have to keep our eyes on. By the way, people that have homes, those house meters, you want to make sure that house meter, ours, is on the other side of our garage. You don't want it anywhere near the living quarters. My previous house, it was right in front of my kitchen. Another reason why we moved. There you go. So now, this is why infrared thermography is the best way to follow our breast health, right? First, I can keep a close eye if there are any cancers or potential problems that can be, such as hormone imbalance. I'd be making sure those lumps in those breasts stay what they're supposed to be doing. I can see way more dense breasts than your 3D mammogram can. Your fibroadenomas, calcifications, etc. So I'm just going to go through some case studies. This is her name, we call her Dee. Dee had her therm July of 2018. She looked normal. I have little things I'm watching here, but that doesn't matter. I'm just watching it. Again, I'm watching for changes in those vascular patterns. Then she came back in 2021. This one stayed primarily the same. The one I was watching, it was the right one that came out. So we want to keep a close eye. One of the things that we do here is we score ours. So I score, so I'm actually watching your scores. A TH1 is 100% normal. TH5, I'm not very happy about it. Does that make sense? So now, Chelsea. Chelsea had a therm April 2019. It doesn't look too good, right? She was a TH3 at 115 and TH3 at 95. Not too good. Now, I love Chelsea dearly. She doesn't live here anymore. She moved. And trying to get her to make the changes in her lifestyle wasn't that easy, but it did make a big change when we did her do it. So we got it 3 years later, and look at that. Look at those numbers and look at how much improved she got. So all you have to do is make lifestyle changes. And guess what one of those lifestyle changes is? Getting adjusted, right? Eating healthy, drinking a lot of water, getting exercise. Lori. We met Lori May of 2016. She was 100% normal. So she was TH1. She's beautiful. And by the way, all of these pictures are the second series. I'm going to let you know. These are all the second series. They're not the, because I do the 2 series aside. These are all the second. January 2021. She came in and you could see the vein, the blood supply coming right here. We did the therm. TH1 stayed the same. TH5. She was diagnosed with invasive ductal carcinoma and triple negative. Triple negative means it's a non-hormonal tissue, non-hormonal cancer. Triple negative, again, one of the fastest aggressive cancers out there. Inflammatory breast cancer, triple negative. So, she made some great lifestyle changes.
Yay.
That was in 9 months.
Amazing.
She still gets therms every 3 months. Because that came up out of nowhere. She thought she was never going to have a worry. How old is she? 60s? 60s? 60s or 70s? 60s or 70s. So now, this just happened 2 weeks ago. This lovely lady found a lump on her breast. We would call the 12 o'clock position on the right breast, April of 2022. She did it in a self-breast exam. She went to the OB. OB said, get a mammogram. They did a mammogram. It was negative. She still wasn't happy. They did an ultrasound. Ultrasound showed that it was negative, which, by the way, is brilliant. So they said, come back in a year. May 2023. This May. They did the mammogram. Oops. That didn't look good. Do an ultrasound. Oops. That don't look good. Did the biopsies in July. Positive for invasive ductal carcinoma. Now, had she done a therm, because she just did her therm, you tell me if we could have caught that.
Yeah.
Guess how old she is?
31.
She's 31. Did medicine screw up?
She screwed up.
You feel sorry. They just don't know about this. It's the only reason why I'm here. It's the only reason why I'm begging you guys to spread the word. Because I don't even have to explain that therm. That hurts me. That hurts me. So, I'm going to do the medical money machine, the mammogram. I'm going to do a thermogram. This person here, would you mammogram that? Would you mammogram that? Would you smash it? So this lovely lady, stage 4 breast cancer. Guess how old? 30. 30. Now, breast cancer is a 15-year disease state. Her background, birth control when she was younger because of menstrual cycles. And they put her on Accutane for acne. at the age of 15, 12 and 15. Stage 4. Does that make sense? Our job is no. Does it make sense? So that's why I'm asking you all to become what I call a woman of wellness warrior. I want you to tell everybody about what breast health really is, about what thermography can actually diagnose and show, and also help you guys see that it needs to be done correctly and to keep those warning signs out on all of those other aspects. So I want to thank you all very much for coming and for hanging out through this process. I'll give you all a hug. Yay!